We are now live. I am doing a sound check. Sound check one. Sound check one. Back to pre.
Good afternoon, subcommittee members and members of the public who may be watching along at this time. I'd like to call the meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals in the media may also be audibly or visually recording this meeting. All electronic devices except those except those used to participate in this meeting are to be switched to a non-audible function during the committee meeting. And members are advised and reminded that we have a 5-minute time limit when asking questions, which will be adhered to during this meeting. Members can submit another request to speak if you require more time to ask questions or make comments. Before I begin roll call, I'd like to welcome Medora Uppel and Paula Whitlow to the subcommittee. Medora and Paula are the new representatives of the Women Housing Planning Collaborative, replacing Carol Cohen-Marneau and Catherine Kalinowski, who have completed their terms as co-chairs of the organization. I'd also like to welcome Mary Vaccaro, who has recently identified as the subcommittee's new representative from the Community University Policy Alliance on Gender-Based Homelessness. With that, I will take roll call, so please indicate your presence verbally when I call your name. Councillor Collins.
Present.
Thank you. Councillor Farr.
Present.
Councillor Wilson.
Present. Good afternoon.
Good afternoon. Medora Uppel.
Present.
Thank you. Mary Vaccaro.
Present.
Thank you. Paula Whitlow.
Present.
Thank you. Saud Badri.
Present.
Thank you. Rachel Bowman.
Hi.
Hi. Chelsea Kirby has sent her regrets, and Rob Mastriani.
Present.
And Nadia Zalesko. Present. Thank you. So as our first item of the agenda is appointment of vice chair, as Carol Cohen-Marneau is no longer on the subcommittee, we'll need to appoint a new vice chair. Are there any nominations for vice chair of this committee? Perhaps keep.
I'll do it. Okay. I'll learn the position. Okay.
Rachel, you're interested in
Yeah.
serving as vice chair?
Yeah, I'll learn
Won-
it.
Wonderful. Thank you for putting yourself forward. May I have a motion from another committee member to put forward Rachel's name as vice chair? Moved by Saud, second by Councillor Farr. Thank you very much. So all in favor, please indicate by raising your hand. Any opposed? None. It's carried. Welcome, Vice Chair Bowman. Moving on to second item on the agenda, and that's the approval of the agenda. Madam Clerk, are there any changes to the agenda?
No, Madam Clerk, there are no changes to the agenda.
Thank you. And moving on to approval, may I please have a mover and a seconder to approve the agenda as it is before you? Moved by Councillor Wilson, seconded by Medora Uppel. Thank you. All those in favor, please raise your hand. Any opposed? And that carries. Moving on to item 3, declarations of interest. Are there any declarations of interests? Seeing none. Moving on to approval of the minutes of our previous meeting, item 4, December 4th, 2020. May I please have a mover and a seconder to approve the minutes from our December 4th meeting? Moved by Councillor Wilson, seconded by Councillor Farr. All those in favor, please indicate. Any opposed? And that carries. Moving on to communication items. Item 5, we have one correspondence before subcommittee. Item 5.9 is a correspondence by Jennifer Humpoth, my apologies, respecting the need for targeted housing for women, non-binary, and transgender people. May I please have a mover and a seconder to receive the correspondence, and then we can open it up for discussion on the correspondence. So moved by Rachel and seconded by Paula. Are there any discussion points or questions that committee members want to raise related to this correspondence? Councillor Wilson.
Thank you very much. Appreciative of the time with my 5 minutes, so I'll try and be focused to the best of my ability in my comments or questions. I found this piece of correspondence to be very enlightening and valuable and has raised a few questions for me. Just for the information of my committee members, I'm council's representative on the city's LGBTQ advisory committee. And it's with some of the conversation that takes place around that table, along with this correspondence, that my questions are based. I'm particularly interested in the comments about the paucity of any single dedicated LGBTQ2S plus health organization or housing organization advocating for and providing data with respect to the housing needs of the community. And so my question, Chair, is to staff. Where do we go for data to guide to instruct us on this? And who do we go to guide our instruction on this in terms of housing need?
Good afternoon. Through you, Madam Chair. Councillor Wilson, on the housing side of things, we record data on gender identity in our centralized database. That said, it's up to every individual to select the gender that they identify with. So it is I think widely accepted that our data that is specific to people who may identify as gender diverse is significantly underrepresenting the actual usage of services by people who may be part of the gender diverse community. So that in our housing data, I have to acknowledge is quite limited. And so we instead need to rely on the expertise of service providers and advisory committees and community groups, such as the one that Councillor has referenced.
Okay. May I ask if you have at hand a supplementary on that answer, if I may, through you, Chair. Our service providers and our community groups that we rely on for the data, would you be able to identify some or all of them?
Yes, I fear that sorry, through you, Madam Chair, I fear that I may miss some speaking off the top of my head, but with that, I can say that uh, um, feeding into the data system we have are all our intensive case management funded programs, our rapid rehousing programs, our outreach services, our emergency shelter services, both in the men's and women's system, our hotel overflow spaces, our drop-in services, both for women and men. And then there are plans to onboard the rest of our city-funded programs, which include prevention programs, a transitional housing program. Sorry, I overlooked the YWCA transitional living program. It's also feeding into the database. So the intention is for every city-funded program providing homelessness services to feed into that database.
Thank you. I really appreciate that, if I may. So this database, so excuse my ignorance, but who is the keeper of it and where is it housed? So that's one question. And the second question is, do we have a policy paper sort of setting out some of the challenges and directions or best practices with respect to housing for members of this community?
Through you, Madam Chair. Thank you, Councillor Wilson. The first question is where is it housed and who's the keeper of the database? It's Housing Services Division at the City of Hamilton who is responsible for the database. And it's an online platform that individuals are able to access at each location as listed previously. And there is, to my knowledge, no current position paper on the subject you've inquired about.
Okay. mindful of my time, and I will hand it off and let others ask questions. I may need to come back. If there is no current position paper, what are we using as a corporation to guide our policy actions on this front? My understanding that particularly LGBTQ2 youth are overrepresented in homeless youth population. Some estimates put them at 25 to 40%. And there are some communities that are trying to acknowledge this and provide unique shelter and housing programs to reflect that. So what are we using to inform our policy priority and funding on this front?
With 20 seconds remaining, Councillor Wilson.
Thank you.
Through you, Madam Chair, Councillor Wilson. So there are overall EDI analysis that do exist, and analysis and papers on that level. And often when there is gender analysis, it does include gender diverse individuals, but there is not a specific standalone document. So that was, I think maybe I wasn't specific enough in my answer. So certainly the experience of non-binary and trans members of the community accessing homelessness services does factor into our policy analysis, and certainly in program delivery as well.
Thank you, Nadia. And Councillor Wilson, if you wanted to come back, I'll put you back on for a second time on the topic. And moving to speakers list, next up is Rachel Bauman and then Medora Opal. So Rachel, the floor is yours.
Hi. I just wanted to bring up again that newcomers, when they come to Canada, can be placed in homeless shelters. Mentally ill women when they can't find housing, get put in homeless shelters. I did not see that reflected in the data. Is there data on this issue? And I would like to also know, what were the steps that you took when you created this data to analyze the different sections of homelessness in regard to women?
Rachel, is your question in relation to the correspondence that's before us, 5.1, or is it in relation to the previous report that we received as a committee?
This point is in regard to, I guess, the previous, what you said, the second point you said.
Yep.
Because I have mentioned this before and I have not yet received a response. So I would like a response, please. Thank you.
Thank you. Who from staff? Nadia, would you like to answer that?
Through you, Madam Chair, could the question be repeated, please?
So as I heard it, it was the integration of newcomer experiences and the experiences of women with mental health as it relates to accessing the shelter system. And Rachel, if I mischaracterize that, please take the opportunity to specify your question. That covered it? Okay.
Through you, Madam Chair, to the committee members, subcommittee members' question, there is any information we have and analysis we would need to draw would have to come through the data available in our database, and we would have to have a specific query to do that analysis. That said, there are a number of programs in our community who are serving women who are newcomers to Canada, and within their programs who have a level of expertise and anecdotal information that would certainly supplement anything available in our centralized database as well.
Can I ask you one question? Did you know about those types of homelessness? Did you know that yourself? That those groups of people are a part of that?
Through you, Madam Chair, yes. Just on a personally, yes, I've worked in the past for the United Nations High Commissioner for Refugees for a number of years. And when coming back to Canada, I worked for a settlement organization and then for Citizenship and Immigration Canada on refugee issues. So it's an issue very close to my heart on a personal level. So yes.
Did you know about mentally ill women as well?
Rachel, is that question to Nadia again?
Yes, it is.
Okay. Nadia?
Through you, Madam Chair, yes.
So, if I may, Rachel, so you're inquiring about data related to newcomer women experiences and women with mental health and their experiences related to homelessness. And Nadia, I heard you say that the data set is available, but it would need to be queried specifically in order to pull those numbers. Did I hear that correctly? I'm just trying to see if we can move towards some direction around other data that the subcommittee is seeking in order for us to work with the same information set in order to clearly understand the need and therefore move forward with our mandate as a subcommittee towards solutions.
I want to specify it's not mentally ill women experiencing homelessness because that's an issue in itself. I want to specify that it's mentally ill women who are already in the hospital, who are already accessing care, and they cannot be discharged unless they find housing. I have met women that have been in the hospital for months simply due to that issue. So I just wanted to make that explicitly clear that mentally ill women who are homeless, there's many different subsections under that umbrella of an issue as well.
Thank you. Okay. So I see a nod from Nadia, and I'll raise the points again at the end of this discussion. So moving on to the speakers list, we have Medora and then Saud. Thank you.
Thank you. I just want to respond to Jennifer's comments about two-spirited LGBTQ plus youth and the need for housing. This is an issue that the Women's Housing Planning Collaborative has actually talked about as a concern. There is clearly a gap in housing options and an increased concern about the security of housing for 2S LGBTQ plus folks, particularly youth, and particularly trans women. We're hearing that housing is more precarious, but I think it's important to keep in mind that the concerns that are being brought to us are being brought by those who are engaging directly with that particular population through other types of services. So specifically, a Spectrum, which works with YWCA Hamilton, has raised, they work with the youth, two-spirited LGBTQ plus youth, and they've identified that they are, as part of, over the period of the pandemic, they've had an increasing number of people come forward who have no housing options or are fearful they're losing their housing options, losing their housing. Or having difficulty finding new housing because of their identity. It's a high risk concern for them. We're hearing from Spectrum specifically that this is causing issues for people's mental health as well. And there is no particular service that they can direct these individuals to. That in terms of what they're doing for support is check-in. So at the Women's Housing Planning Collaborative specifically, we're interested in understanding and engaging more in this issue and getting more information insight directly from those working in the field. But as indicated in Jennifer's comments, there is no 2S LGBTQ plus specific service dedicated organization in Hamilton. And so there is a gap in knowledge and information out there.
Thank you for that, Medora. Moving on to Saud, please. Oh, Saud, you're muted. We can't hear you. So you're just going to have to re-indicate. Saud, can you hear me? We cannot hear you. So make sure you turn your microphone back on.
Right, thank you.
There we go. Thank you.
Yes, actually, my name is Suad.
Suad, my apologies. Thank you for correcting me.
Okay. Yeah, Saud reminds me of Saudi Arabia or something. Anyway, the thing is, in my community in particular, Muslim Black women or Muslim women, the trend is for a woman who needs to go to a shelter, the community gets together and stops that. The community is caring for sure, but it's in a way like stopping that woman from getting her rights. And so, in a way, statistics does not track that. They are missing from the statistics. There needs to be like certain techniques to trace those women and get the information on their regard. Maybe like from newcomer statistics or Kennedy statistics that tracks women as in newcomer and where they go, where they live, what's their housing conditions, what's their social conditions. I know maybe it's not official, but Muslims can have 2 and 3, 4 wives, and that may happen even in Canada. So those women may need shelter sometime, but in order, because of the legal situation of their position, they would not uh, venture on their own to do that. And statistics totally fail because the smaller community protects that information. So those women really need to access this service, and statistics does not report them. So I guess there should be a way, to extract statistics like some correlation or some statistics. Thank you very much.
Thank you, Swad. So was there a question there or just comment as it relates to the topic that we've been discussing?
It's to add another dimension to the topic that's being discussed.
Thank you, I appreciate it. Moving on, the speakers list was Councillor Wilson for a second time and then Rachel for a second time.
Thank you, Chair. I guess what I'm hearing is there is a paucity of, there is definitely a need, and there's definitely an emerging need. And I'm speaking specifically to the LGBTQ community. But I think what I've also heard is there is no defining place in which we can point to as a community that is informing, that should inform our priority setting and our strategy, and also confirming that need. And what I've heard is that's been prompted by this piece of correspondence is in my capacity on the advisory committee, Medora's capacity where she is, this seems to be and I know there was a need assessment that was started or completed rather under the auspices of McMaster's Labor Studies that was very extensive in its community outreach. I think there is a need, but what I'm uncertain of is a policy paper and a set of agreed upon facts and or priorities and directions, and what the role of this corporation is in that regard. So I guess I'm looking for some feedback from you, Chair, and or the other committee members on do we seem to have an agreement here on a need? Do we seem to have an agreement on a vacuum? And do we seem to have an agreement on a need for some sort of action? And what action should that take? And should that take it in the form of requesting staff to come back with, can we do a sweep of how those needs might be defined, what those needs might be specific to Hamilton, and what that might mean for future strategies going forward. And I'll look to my fellow committee members to speak to that suggestion. Thank you.
Just jotting that down. Thank you, Councillor Wilson. Moving to Rachel, and then I'll come back on this item, Councillor Wilson, because what I'm hearing is you wanting to propose clarity by the subcommittee about this need, testing whether or not the subcommittee agrees that there is this need for this information, and what next steps we as a subcommittee may take in order to receive that information. Rachel, the floor is yours.
I'm not sure if anyone is aware, but there's a whole academic journal dedicated to refugees in Canada called Refuge, and most of the data I've read by them is done by refugees themselves. So there was that, and I've noticed a lot of like people dividing sections. Like, I want to focus on LGBTQ. I want to focus on newcomers. I want to focus on mental health. Those all overlap. They can all be the same person. Like even at Spectrum, there's a service for newcomer LGBTQ people. So I feel if you don't forget that these aren't like, yes, like they all have separate needs, but and again, like they overlap countless times. So it's just like to remember that when you advocate for newcomers, you're also advocating for queer and trans people. You're also advocating for mentally ill people. So I just wanted to add that as well.
Thank you, Rachel. So coming back to your point, Councillor Wilson, so there was a request for committee to consider what Councillor Wilson was saying. We could put that forward formally in the form of a motion with clarity around direction. But if there's any other committee member that had thoughts or ideas that you wanted to share on this topic, since we're here, before we move off, let me know. Medora.
So as Councillor Wilson mentioned, there was an extensive report already done by McMaster around sort of the needs and the gaps in for services for two-spirited LGBTQ2 plus or plus people that we can reference. The advisory committee has a lot of insight as well, I think, to offer on the topic. I think we'd be, I would be concerned, and I'd actually ask Mary Elizabeth about this from a CAPA's perspective, about engaging too deeply in research and data that's very hard to obtain on this topic, and focusing more on recommendations that could be made around how to address the gap, because we know the need is there. In the correspondence we received, it stated a recommendation around, housing support workers specifically. That may be a suggestion. I think ideas around how to address the housing issue coming from city staff would be valuable, rather than focusing on the research around needs and gaps. And I'm not sure if that's where the councillor was going with the recommendation, but I just wanted to make sure we didn't go down that rabbit hole.
Thank you for that, Medora. I see a thumbs up from Councillor Wilson on that refinement. And then I'm not sure, Mary, were you indicating as well? Go ahead.
Thank you. So I agree with Medora. I don't necessarily think there's a need for more research. I also think that if we try to quantify this particular group of folks, that we would under quantify that because we know they don't present in services because of the way the shelter system is sort of divided among this gender binary. But I think recommendations based on existing research would be a good place to start.
Thank you for that, Mary. Rachel? Yep, go ahead, Rachel.
My experience when I did research myself with my college, and then I took the research and moved it to make an initiative to better education, like bridge the barriers for newcomers to access better education. There were so many assumptions I made by the research. It was only when I went into the classroom and talked to them and got their opinion on what they specifically wanted did I understand there's a big difference between what's on paper in the research and what the people really want when you talk to them. So is there any possibility that we could go into the shelter? We could have an anonymous submission specifically from people in Hamilton and hear specifically what they want.
Rachel, was that a question to committee members?
Yes, like anyone can answer that question.
Okay. I saw Medora put up her hand. So Medora, on this question?
Yes, specifically on this question. If my suggestion would be that there are agencies that are or programs like Spectrum, as well as some others I can think of, that are directly working with LGBTQ populations, but there could be an opportunity to have a conversation with what they're seeing in terms of services, to get that perspective that Rachel's speaking to. But again, there's an underrepresentation broadly in the community, and even those I think we would not have all the information, and we need to start somewhere in terms of addressing the housing gap and the crisis that the community is facing. So it might delay us, but it doesn't mean that information gathering or processes or talking to people can't be part of a process, but I don't think we can afford to wait for that process to be completed to address the issue.
Thank you. Okay, so subcommittee, we were technically on communication item 5.1, and the correspondence did what it was supposed to do, which is inspire a discussion among subcommittee members as it relates to the topics raised in the correspondence, but also the intersecting reality of those that are raised that other subcommittee members have raised as well. So we have an expression, a desire here of subcommittees members wanting to help, wanting to have a baseline from which we are all operating as a subcommittee in terms of best understanding the current needs or learnings as it relates to women, non-binary, and trans folks as it relates to homelessness and housing. While there has also been an expression about wanting to do so in a way that doesn't sidetrack us into research and data collection, that still enables us to remain nimble towards our mandate of helping put forward recommendations to solve the need, while also potentially having a third track, which is finding a mechanism or a way by which we may start to gather some of the lived experiences from our program partners, service providers, shelters, and housing providers. So I tried my best there to summarize what I've heard from subcommittee as it relates to this. Tamara, in terms of next steps of the expressions received by subcommittee, do you recommend that we try to clarify direction here and now, or proceed to the next item on the agenda and then come back?
I think we could do either. It sort of depends on whether or not the discussion item is going to speak to or shed light on this topic of conversation, and whether that would add to it. And so then, if you were to put forward a motion now to request that information, whether some of that will already be answered in the report that's coming forward. So it might be an idea to hold off and bring that motion forward. It will also give us time to fine tune it and make sure we've got the text right, and then bring it forward perhaps under other business.
That sounds good to me. Thank you very much, Clerk Bates. Moving on, so we did already have a mover and seconder to receive the correspondence, so we are now at the point of voting in favor to receive the correspondence. Please raise your hand to indicate you're in favor. Any opposed? Seeing none, that carries. So we'll move along on the agenda to consent items. Item 7. And that is Winter 2020 Housing and Emergency Shelter Supports, Report HSC 21007 citywide. I'd like to call upon Nadia Zalesko, my apologies, Nadia, Senior Project Manager, Homelessness Policy and Programs Team, to introduce this item.
Through you, Madam Chair, thank you for the opportunity to speak to this item today. I'm going to ask Rob to please pull up some slides that will allow me to anchor us in this discussion. There's a lot of information in the report, and so I thought this might help us as as we work through it. Thanks, Rob. So going to the first slide, Rob. So at the December 4th meeting, the subcommittee asked staff to report back with a status update on the use of existing housing and emergency shelter supports for women, non-binary, and transgender people during the 2020 winter season, with a particular focus on investments that have been made, outcomes that have been achieved, and further existing strains, including measures that could be taken to alleviate those strains. So in speaking to this item, I'd like to thank Yolisa de Jager, Erin Fotheringham, Pilar Homerston, and Robin Perry for their analysis of these areas to inform the report. One second, sorry, second, Rob, sorry. So on this slide, to the next slide, please, Rob. So for the purposes of this report, winter 2020 will be defined as November to December 2020 for program outcomes, and November 2020 to March 2021 for financial investments. Additional funding that was received and investment decisions made due to the COVID pandemic resulted during this time in expanded emergency shelter services for the promotion of social distancing and mitigation of program outbreaks and general community spread. Of the total funds allocated and distributed through housing services during the time period of the report, 8.2 million was designated to program and support services for women, gender diverse individuals, couples, and families during the winter months. This led to an increase in shelter beds from 46 to 168 by phasing in additional hotel rooms. Women's drop-in services were extended, and city-funded homelessness programs were financially supported to implement infection prevention and control plans. And next slide, please, Rob. In terms of occupancy for the period of November 1st to December 31st, shelter bed and hotel room occupancy was consistently high, with a range of near full to over capacity occupancy rates among women's emergency shelter beds and women's specific hotel rooms. The men's and couples hotel is designed to function as an overflow shelter option to the women's system. And during the same time frame, it operated at an average occupancy rate of 75% capacity, with approximately 25% room capacity consistently open and available. Notre Dame Youth Shelter had the lowest average occupancy rate over November and December at 48%, with up to 6 beds consistently available to homeless youth. Family shelter services operated at near full occupancy and supported an equivalent volume of families in the hotel system in November. As is typical during December, there was a reduction in usage by families that typically occurs around the holiday season. And although it's beyond the periods that we were reporting on, as of January 4th, 2021, hotel capacity was expanded further by an additional 22 rooms. There's further details in the report as well. Sorry, I'm just having a little bit of a technical issue on my end. Rob, if you could please go to the next slide. A total of 437 unique individuals assessed women's emergency shelters or women-specific hotel accommodations with an average length of stay of 45 days. There is an increase in time clients are staying within hotel programs, with more individuals staying in place for 3 months or longer. Longer stays impact shelter bed turnover frequency, thereby reducing the capacity of the program to serve a higher volume of individuals. If these trends continue, the average length of stay will rise and a person's experience of homelessness on average will extend. Next slide, please, Rob. City-funded drop-in programs served a high volume of adult women and gender diverse persons seeking assistance as well. So for example, the YWCA Carol Ann's Place had an average monthly occupancy rate of 109%, a calculation based on 20 program spaces per night. And Willow's Place, operated by Mission Services, reported serving 65 unique women and gender diverse persons from November 1st to December 31st. That should read 2020. Next slide, please, Rob. So housing outcomes achieved in winter 2020. The city funds 3 gender-specific housing programs: Good Shepherd Intensive Case Management, Good Shepherd Rapid Rehousing, and YWCA Transitional Living. Combined, these programs have achieved 34% of their annual housing placement targets 9 months into their funding contracts, which was the period of reference for this report. From November 1st to December 31st, 2020, emergency shelters and hotels directly housed an additional 4 women and gender diverse clients, and men's ICM programs housed an additional 8 women or gender diverse adults. So there's more information in the report, but to give you an idea, the target for the programs listed in the first point was 250, and 77 individuals were housed. If we include family and youth intensive case management programs, which also house women and gender diverse individuals within those households, 110 households were housed. Next slide, please. Oh, yeah. So in terms of strains, the overall strain on the homeless serving system is a combination of factors. There's an increase in individual women and gender diverse adults seeking shelter, accessing drop-ins and sleeping rough. There's a growing average length of stay across this population, most notably in hotel programs, and there are low housing placement outcomes. These factors combined place clients at risk of remaining homeless for extended periods of time. The increase in hotel use represents financial sustainability risks, as renewed funding to sustain this intervention is dependent on other orders of government. And notably, despite the continual availability of overflow hotel space, some women and gender diverse individuals are still utilizing overnight drop-in spaces or staying in encampments. Next slide, please, Rob. External factors have also contributed to the high occupancy and low housing outcomes evident in the women's homeless serving sector, notably the pandemic. COVID-19 is a significant health risk to people experiencing homelessness, specifically to those who have underlying medical conditions and challenges in their ability to adhere to social distance measures. Across the entire shelter system, congregate living designs of physical infrastructures placed additional pressures on systems to reduce crowding. And even in single room shelters and hotels, overall outbreak risks remain high due to the bioburden of all individuals present on site. As the committee members know, Hamilton's housing market remains competitive. It seems like an understatement, with rental costs outpacing income earnings of most individuals who are experiencing homelessness. The rollout of the Canada Ontario Housing Benefit in April 2020 did receive significant uptake by families and moderate uptake by single adults. As additional housing units and supportive housing programs become available and equity, diversity and inclusion analysis is applied to resource allocation, such that 25% of women and gender diverse individuals are ensured to receive access to those resources. And when factoring in youth, families, and individuals who identify as Indigenous, the total overall percentage of women and gender diverse individuals accessing resources increases. Next slide, please, Rob. In terms of efforts underway, at the time of writing the report, the City of Hamilton, St. Joseph's Healthcare, and the Hamilton branch of the Canadian Mental Health Association initiated a pilot project to support individuals experiencing chronic homelessness with mental health and active addiction issues obtain permanent housing with in-home mobile supports to promote housing and health stabilization. And McMaster University is undertaking, it's been undertaken as a research demonstration project with a tremendous value out of McMaster conducting that program evaluation. Through the recent request for proposals that the committee is aware of for emergency shelter services, the successful application aims to bring online additional gender-specific shelter beds and single-room occupancy permanent housing units. This investment through various funding streams prioritizes affordable permanent housing options for homeless women and gender diverse persons with limited incomes. Thanks, Rob. In terms of mitigation strategies, there is an opportunity to review city-funded program staff contingency plans with a focus on strategies to achieve full staff complements in housing programs. And I'm sorry, just on a previous slide, I failed to mention the tremendous staffing pressures that our funded programs are facing. So the ability to hire and retain staff during the pandemic has significantly impacted our partner agencies. And at the same time, redeployment of program staff delivering on housing placement programs to emergency shelter response has further stretched those resources thin, which implement our housing placement outcomes. And I meant to acknowledge that earlier in a slide. So as we look at staffing contingency plans, we could review the new flexibilities which are built into federal and provincial homelessness funding streams due to the pandemic to see what other options may exist for programs. There's an option or an opportunity to support city-funded gender-specific housing programs to develop a strategic plan to increase monthly housing placement rates for homeless women and gender diverse individuals. These efforts could be broadened to include input from additional city-funded landlord liaison roles through the Housing Help Center. And there's opportunity to test innovative housing options for women on limited incomes as is likely required. We could review the hotel referral procedures to ensure that available overflow hotel spaces are accessible to women and gender diverse individuals currently using overnight drop-ins or sleeping rough. Next slide, please, Rob. There's opportunity to explore the potential to support process efficiencies with the YWCA Transitional Living Program, including shortening unit turnover timeframes and expediting intake processes. There's opportunity to cross-reference access to housing applications with women and gender diverse adults to ensure all eligible clients are positioned to have up-to-date applications for subsidized housing. And there's opportunity to plan for the strategic use of housing affordability benefits as they become available to further opportunities for housing placements through city-funded rapid rehousing and intensive case management programs. And finally, continued onboarding onto the Homelessness Individuals and Families Information System, the HIFIS database program. As gender-specific programs progress towards consistent and accurate data entry into HIFIS, there are future opportunities to utilize sector-specific data for planning and problem-solving purposes. Again, the database is limited on information required by programs to get people housed. It does not include health information and other factors. So it's used for planning purposes, but cannot be used as a standalone resource. The database is developed to report on a wide range of data points. These include occupancy levels, service restrictions, and housing placements. Custom reports, as mentioned earlier in our conversation today, could eventually be created to capture other specific business needs in the sector. Thank you. So that touched the main areas of the report as requested by the subcommittee in December.
Thank you, Nadia, for the presentation and the overview of the report in a visual format. Before we can open it up to discussion, we'll need a mover and a seconder to receive the presentation and the report in order to open up discussion. So moved by Mary Elizabeth and seconded by Rachel. And the floor is open for subcommittee members. And Rachel, then Medora, and then Mary. Thank you.
Do we know the turnover rate for the hotel beds at all? Do we know how long the women are allowed to stay in those beds?
So through the chair, the exact number I don't have off the top of my head, to be honest with you, but we can locate that. We do know, to some of Nadia's points, the length of stay in hotels has increased during the pandemic. So the length of stay is longer than what we've been seeing traditionally. But we could circle back with an exact number of an average length.
And Nadia wants to add to that answer as well.
Thank you. Through the chair, Rachel, I don't know if this will help answer your question as well. We do know that from 2019 to 2020, the average length of stay in women in the emergency shelter system has increased by 15%.
Thank you.
One thing I don't think many people are aware is when you get on welfare or ODSP and you go to get housing, you have to have a form. You have to prove to your worker that you have found housing to get your check or get your check continuously. This piece of paper is a clear indicator of like, okay, I don't want to give you my housing. I'm going to purposely say no to you because I know you're on welfare, you're on ODSP. You know what I'm saying? Is there any way that we can somehow change and limit that piece of paper? And also, due to accessibility as well, delivering that form can be very difficult given the nature of your disability or your lack of transportation, lack of money for transportation as well. So I just feel like that's like a small piece of documentation that limits a lot of people.
Thank you for that, Rachel. Were you looking for a response from anyone on that one? Or
Anyone
is just a
has
point?
anything to say additionally to anything I say? Like that would be fine.
Okay, so we'll keep it on the speakers list. So if anybody wants to integrate comments related to Rachel's point, please do so. So next up we have Medora, and then we have Mary Elizabeth. Thank you.
Thank you. And through the chair, I just wanted to ask a question related to the written report that was provided and some information that had been published in, I think, was CBC Online this week about the 15 additional shelter beds. There were, it was WIPIC's Women's Housing Plan Collaborative's understanding that the RFP process was intended to replace the 15 shelter beds that were not available at Mountain View. And that those beds were going to be coming online April 1st, 2021. And that the hotel was temporarily there and provided additional beds, far more than the 15, which we desperately needed in the system, but that those beds were coming online permanently April 1st. My understanding is that the project that is being supported will not have beds come online until December of 2021 at the earliest. And there's still, according to the article, some questions or information about where the location will be and firming that up and other funding that's potentially attached to the entirety of the project. So the project is a good project. It's going to create great investment in terms of needs we have in the community to fill the gap around women's homelessness. But I want to get clarity from staff through you, Chair, if what the plan is for those 15 emergency shelter beds that do not exist in the system currently.
Thank you.
So through the chair,
thank you.
Through the chair, as you know, through the recommendation that was approved for the first project, there was a secondary project that was also approved in the event that the first project was not successful. So that plan B option is still something that we can explore. For the time being, until we determine what next steps would be, our contract with the hotel to continue operation of those temporary expansion of overflow spaces continues at this time. Where right now we have a contract until June, and then because we understand the impacts of COVID are not necessarily going away right now, we're looking at whether or not it's possible to extend that contract later into the year, which would also cover those 15 temporary beds at this time. So those beds will be extended for the time being until we can figure out what the next permanent steps are for a permanent solution.
Thank you, Rob. Medora, did you have any further questions based on the response?
No, I didn't have further questions based on that particular response. I think I just want to indicate that the beds are critical to get in the system, and that we need to have permanent beds in the system. From WIPIC's perspective, it always needed to be there, and so we need assurance that there will be 15 beds replaced permanently. Thank you.
Thank you. Next is Mary Elizabeth, and then Suad. Thank you.
Thank you very much. And through the chair, I just had a few questions for Nadia based on the presentation. So thank you so much for doing the presentation. It was really interesting. I'm wondering if there was any data collected on the folks who were housed successfully, whether they would fit the classification of high acuity, or if they were low acuity clients.
Through the chair, thanks, Mary. It's a good question. So the data presented was a pull uh, um, from HIFIS. It wasn't a research piece. And so I don't have the answer to that question in the context of the report. Nevertheless, that information is available. I just don't have it on hand in this moment. But yes, that information does goes through the housing programs.
Okay.
I can say that typically if someone is housed through an intensive case management program, they have a high level of acuity. They're individuals who have been experiencing homelessness for an extended period of time. Usually usually if not always, they have experienced chronic homelessness and their level of acuity is high.
Thank you. And I just have one other point, I suppose, based on the presentation. I found what was most interesting in the presentation to me was the existing strains and the way those were presented, particularly with places like Carol Ann's Place being at 109% occupancy and the increase sort of in long shelter stays. So it's really exciting to hear that there could be some investment in supportive housing, but I think the biggest strain right now in the system is the absence of really low barrier permanent supportive housing that can successfully support in-house folks who are kind of experiencing that high acuity and finding themselves in places like the drop-in centers. That's it. Thank you.
Thank you, Mary Elizabeth. Next is Suad and then Paula. Thank you.
Well, thank you, Nadia, for the report presentation. My question is on the tail of the presentation, there is a slide mentioning HAFIS as a resource. Am I correct? Yes. Okay. So can you please elaborate more on that? Is it like a trend of filling the gap in stats? Or can you elaborate more on that, please? Thank you.
Through you, Madam Chair. Thank you, Suad, for the question. I will begin, and then Rob, please feel free to jump in with additional details that might help to satisfy the committee members' questions. So HIFIS is a database which we use for service provision purposes. So when an individual books into a shelter, that they are booked in through the HIFIS database program, and we collect data likewise through individuals who are supported through our other programs. So it's a service provision tool, but it also is very important in terms of gathering basic information around who is accessing the system, how long they are in the system, and gives us a somewhat of a sense. Again, it's not exhaustive because it's meant to be a tool to support service delivery, but of what those needs of individuals are. And that's used for program planning purposes. It's used for resource allocation and strategic investment of resources in combination with other data available to the city, if I've understood the question, and Rob perhaps has something to add as well.
Through the chair, I think actually, Nadia, you gave a really good summary there, so I don't have anything to add.
Thank you. Suad, any other follow-up questions?
No, that's fine.
Thank
Thank you
you.
very much.
Moving on to Paula. Thank you. Paula, we can't hear you. You'll have to turn on your microphone. Still indicating that your microphone's not on. Yep.
Hi there, sorry about that. I keep hearing and reading that these 15 beds when Mountain View closed was lost, and that is not the case. The 15 beds are still there. We're at 80% capacity. We had a hard time finding funding when we closed at the end of August. We didn't actually get any funding lined up until December, and now this funding is only temporary till the end of June. So I just want to reiterate, and it's not just specific to Indigenous people, though we are an Indigenous organization and that is our priority. We accept everyone from the community that are basically homeless to live transitionally up to a year. And we're currently now trying to find other supports to sustain them so that they can find safe, affordable housing in the long term.
Wow, thank you for that information, Paula. Staff, would you like to comment on that, please?
So through the chair, I think the difference is the operation of those 15 beds as emergency shelter beds. My understanding is that those beds, Native Women's Center at the time was not in the position to continue to operate those beds as emergency shelter beds for women. So the contract for that particular service came to an end, and we are temporarily operating those 15 beds out of the hotel location, in addition to the other overflow spaces that are there. So my understanding is that those beds, those spaces continue to be in existence through Native Women's Center and the location that they are operating, but they are functioning in a different way other than emergency shelter spaces.
Thank you, Paula. Did you have anything else?
We're just right now in the position where we're halfway through to the end of our funding running out, looking for, again, permanent funding to continue to operate and provide services to the Hamilton community.
Thank you. Moving on to Councillor Wilson and then Medora.
Thank you, Chair. My apologies, I'm just trying to find the report. I was wondering if I may have missed it, but if staff could just speak to me about, help me understand the Good Shepherd Notre Dame facility and the low occupancy there, please, through you.
So through the chair, Good Shepherd Notre Dame is a youth shelter that operates, I believe, 16 beds, if I can recall correctly off the top of my head, for youth. It is not specific to women, men. So it operates. It traditionally has had a lower occupancy rate. They have a very successful shelter diversion program and family reunification program for youth. So though they have the 16 or so beds, they have traditionally occupied or operated at a lower occupancy rate with beds available.
Thank you, Rob. Through you, Chair. So that number of under 50% is not an anomaly then? No. That's typical. Okay. At the conclusion of the report, there is a list of mitigation strategy options. And I have a question about the status of those and the responsibility of this committee in relationship to those. Could you put those in context for me? Are they listed for that these are under consideration? Are you listing them for us to have a discussion and debate about whether they are in fact good options? Are you listing them because you're looking for direction on some movement on them? I'm not sure what, if you could speak to them, please.
Through you, Madam Chair. Thank you, Councillor Wilson. It's a good question. So our understanding from the motion had been that the subcommittee was looking for staff to propose mitigation strategies for existing strains. And with that, at the time of writing the report, these were 7 that were under consideration at that time and have since been, at least on some of the points listed, discussion around them, as well as anything additional not in the reports would be welcome for staff.
Through you, Chair. Nadia, I'm sorry you cut out a little bit in your response. And I'm just wondering if you could summarize it again because I missed part of it. I don't know if that's unique to me or if
I experienced it as well. Nadia, maybe try cutting off your video so that we're focusing on your audio so we can hear you throughout.
Through you, Madam Chair. I'm sorry about that. Is this better? Looking
Much
for
better,
some...
thank you.
Okay. So our understanding of the of the report back request was to propose mitigation strategies based on existing strains. So at the time of writing the report, those were 7 mitigation strategies that were under consideration at Housing Services based on ongoing and very regular discussions with our community partners and sector partners. Since the time of writing the report, some of those have already begun to be actioned, and certainly feedback from this subcommittee on those particular points or any additional points is welcome and well received by staff.
Okay, if I could ask, if I have time, Chair, through you, would you be able to speak to those in which action has commenced and what that means for the balance or what that means for the order of them? I'm sorry, Nadia, my problem, not yours. I'm just not clear on what we could do here.
Through you, Madam Chair, I'm just going to pull it up here and I'll go through them one by one. So in terms of reviewing city-funded programs, staff contingency plans with a focus on strategies to achieve full staff complements and looking to see what flexibilities might exist in COVID funding we were receiving. I think that what we're saying here is that there is flexibility that hasn't previously existed through federal funding in particular to consider investments in staff beyond in areas that wouldn't typically fall to a municipal level or housing services. So addiction support, mental health workers, et cetera, nursing supports. So I think looking to see how that could complement and strengthen housing placement outcomes in consultation and coordination with our funded programs. So we are reviewing those guidelines and some of those discussions, as I said, they've been ongoing for quite a while. We're hearing loud and clear from our sector partners that mental health and addiction supports is critical. So as we're coming up and finalizing our financial reporting from the current fiscal year, we're able to see what resources are available and how we might direct them. So that is currently sort of live work as we're wrapping up this year's end and moving towards rolling out in the next fiscal year. The second point was to support city-funded gender-specific housing programs to develop a strategic plan to increase the monthly housing placement rates for women and gender diverse clients. And then broadening this to include input from additional city-funded landlord liaison roles. So prior to the pandemic, the intensive case management providers regularly came together as a collaborative to discuss and troubleshoot some of these issues. During the pandemic, those same actors come together usually a couple times a week, but in the format of pandemic response. So we haven't come together as a specific group, but that is something we're turning our attention back to in this new fiscal year as we. I mean, I have to say that we're very respectful of how stretched thin our implementing partners are to ask them to attend another meeting, but they have expressed interest. And so that is something we're coordinating moving forward. As an example, it's also linked to the first point. Review hotel referral procedures to ensure that available overflow hotel spaces are accessible to women and gender diverse individuals currently using overnight drop-ins or sleeping rough. I could defer perhaps to Rob if you wanted to add more details, and even there's members of our subcommittee, Medora, for example, who could speak to it, but we're in ongoing discussion to see what's working, where there are gaps, and how we adjust in real time. So there's current discussions going on. And when I'm finished going through the list, Rob or Medora may wish to jump in. Exploring potential for process efficiencies with the YWC Transitional Living Program, including shortening unit turnover timeframes and expediting intake processes is something that we have reached out and spoken to Medora about, and we'll continue to have a dialogue around. It's obviously discussions are often resource dependent, and so those are ongoing discussions to see what we can do within our current resource allocations and what might be on the horizon for us to plan for. Councillor Wilson, is this what you were hoping for as I continue? Okay. Cross-referencing the access to housing applications with women and gender diverse adults to ensure all eligible clients are positioned to have up-to-date applications for subsidized housing. That is something that our programs do on a regular basis as part of their case management. I think what we were saying here is that we wanted to reach back out knowing that programs have been stretched thin and that clients' needs themselves have been quite diverse during this time to make sure that that is happening and to provide any support we can as a reminder to ensure that that continues so that clients are best positioned to be ready to accept an offer of a unit should it become available to them. Planning for the strategic use of housing affordability benefits to further opportunities for housing placements through the city-funded rapid rehousing and intensive case management supports. I will say that across the board, coming back to an earlier point in the report, housing affordability is a concern. It's a real impediment for our funded programs to be able to place clients who are interested in housing in an appropriate unit. And so we are continually looking, advocating for resources to increase affordability for clients and trying to be as creative as we can in that regard. Since writing the report, we have been able to secure 50 additional housing allowances, which we are distributing among city-funded intensive case management programs with a specific allocation of 30% to the Indigenous community as determined through the Coalition for Hamilton Indigenous Leadership. And at the same time, we've received word through the province that there is an additional allocation for Hamilton through the Canada-Ontario Housing Benefit. And as put forward to Council last year, the priorities for that through the province, layered with our local priorities, include survivors of domestic violence, people experiencing homelessness, and seniors. Layering our local priorities on top of that, of course, are members of Hamilton's urban Indigenous community. So individuals who had previously received a housing allowance for 5 years where that term is expiring, they will be the first individuals prioritized to receive this new benefit. Essentially, if I may, just to say, to get them off the treadmill of housing instability if their current benefit were to expire. So any remaining benefits after that time, 30% will be allocated to the Coalition for Hamilton Indigenous Leadership to allocate to meet the needs of the Indigenous community. And the remainder will roll out in a similar demographic perspective as per the EDI lens mentioned earlier, to ensure that at least 25% are also going to women and gender diverse individuals in the community. I will say we continue to advocate for additional resources in that regard. And then continued onboarding to the HIFIS database program. There's been such tremendous work, and I really have to just reiterate that in the middle of the pandemic, being very stretched thin with staffing, how much effort that the staff and women's serving programs have made to get onboarded, trained, and to consistently use HIFIS. It's one more thing to juggle during a time where they are stretched quite thin, but I'm pleased to say that that is going very well. And we're seeing benefit from that in terms of being able to understand the data and also gaps in the data and information available to us as that information on women and gender diverse individuals builds out.
Excuse
me. Thank you.
No, thank you, Nadia. So on all of 7, it sounds like there is action being taken and work being produced, which still, for me, I just want to ensure that there is, are you looking to this committee for anything further or specific or in addition to that which is set out on page 8, 7 and 8, beg your pardon. And I haven't heard that from you or Rob to date. Is that correct?
Counts through you, Madam Chair. Councillor Wilson, thank you for the question. The question wasn't, I don't think we'd understood the question in that way of what could the subcommittee do in addition. So certainly feedback is appreciated, but I'm mindful of Mary's comment from earlier in our meeting about the paucity in permanent supportive housing for women. Municipally, we are advocating for additional resources, but we are limited in what we can offer as a municipal service manager in terms of permanent housing. Our funding envelopes come in 5-year cycles where we know that women and gender diverse individuals accessing permanent supportive housing typically require those services and supports for an average of 3 years. So we are unable to commit to funding required solely without partnership, and a natural partnership would be with the health system, because part of those permanent supports that are required include primary care, addictions, and mental health supports, for example, in addition to the intensive case management supports that our sector is so skilled at providing. So if I may, through the chair, I think perhaps at a council level, in a subcommittee level, there is room to join us in advocating for those funds and pursuing those partnerships that we are currently working very hard to move forward. But I think there might be an opportunity there, if I may.
Thank you. I'm going to give up my time and looking forward to what other folks, I think Medora's after me, might have to say about it. Thank you.
Thank you. And I realize I've been trying to chair without my microphone on, so you wrapped yourself up on time. I appreciate that. Medora, and then Rachel, and then I'm adding myself as a first-time speaker on the report as well. Thank you.
Okay. Through you, Chair, I would like to respond to some of the pieces Nadia raised, but I'd also like to first respond to what Paula had stated. So what I heard from Paula was that there still exists 15 beds that was at the former Mountain View that's currently at, offered as transitional housing beds. Transitional housing is part of the homeless response system, an important part of the homeless response system for women who are homeless, and addresses women's homeless needs. It has a supportive component to it. It does have outcomes of housing as demonstrated in the information in the written report. At least YWCA Transitional Housing does, and I know Native Women's Center also has a goal of housing women through that. But what I heard from Paula, if I understand, is that that funding is temporary and is going to run out. And there's no source of future funding for that. And when we're talking about needing to replace 15 emergency shelter beds, and we have an opportunity to support 15 transitional housing beds, and we're choosing not to from an Indigenous partner, it's concerning to me to hear that information. And I'm raising it at this table as something I would hope the subcommittee could talk about to address. In it, yeah, I think that's where I want to land on that piece at this point.
Thank you, Medora, for that. I will be bringing a suggestion forward as chair on those points when it comes to my turn to speak, which is right after Rachel. Thank you.
And can I respond through you, Chair, to Nadia's, the mitigation strategies as Nadia outlined them?
Sure, you still have time.
Okay, great. I think just to clarify, there was some discussion about HIFIS, and I know HIFIS is in the recommendations, and then the information we received in the report indicated some numbers. We have been adapting within the women's sector HIFIS into new spaces like our drop-ins and transitional housing, which provides more information and more data. I want to be clear that HIFIS does not capture all women who are homeless in our community. Women who come into drop-in or low barrier services are not required to identify themselves or use their full names. And if they don't, we can't enter them into the HIFIS system. So it continues to be underrepresentation within those numbers. I'm not clear from the staff report if those numbers provided around the number of homeless women reflects the new partners on HIFIS, or if it's only on reflecting the numbers provided by the women's shelters who are already participating in HIFIS. So that was a question that wasn't clear to me. And the other piece in terms of the mitigation strategies, some of the pieces are being worked on. I think there's limitations from the women's sector perspective in terms of how much further we can go in terms of changing things, like the hotel referral system or processes. We meet weekly to go over hotel referrals, and we have difficulty making traction and movement. It's not that the hotels aren't doing a great job; they're actually taking in a lot of folks, but we're not sure that there's an issue with process there. And then the other piece is the benefit, the housing benefit that Nadia referred to that's coming back. We saw that as a really helpful investment to help women get housed in our community. The goal is, I heard Nadia mention of 25% at a minimum, which aligns with some national housing strategy numbers. I would suggest if we want to make a real dent, that number could be increased. That's a minimum 25%. Women's homelessness continues to be underrepresented in terms of data, statistics, numbers across the country and in Hamilton. I think it's reasonable to look at an increase from 25% to a higher number as a minimum to get those benefits into addressing the women's housing crisis in particular.
Thank you, Medora. Moving on to Rachel.
I just want to comment on Notre Dame. I really like that service. A lot of my friends use that service. It was very good. But one of their protocols is I don't know if they do this to everyone, but they'll call your parents. And if your parents say, "Oh, I want you home," then they do not let you in. And they denied me because of that. And let me tell you, when I went home, I left again and I had to go into adult shelters. So maybe a reason that they don't have overcapacity is because they are denying people that they think don't need care. So I just wanted to add that too.
Thank you, Rachel. So in order for me to ask some questions and raise a point of action, I'm going to turn the chair over to you, Rachel. So through you to Nadia and Rob, thank you for the report and the overview. And also thank you for the breakdown on the amount of actioning of the mitigation strategy options that have been outlined in the report. I really appreciated that. Notwithstanding that there is some potential for us to boost up some of those mitigation options as a subcommittee, if this committee so chooses. But in regards to the 15 beds that Native Women's Center has shared with subcommittee that they are currently maintaining operation of, but are going to lose funding, the 15 transitional housing beds, through you to staff, is there, would it be appropriate if this subcommittee were to request housing services staff to connect with Native Women's Center to explore and or address the investment gap to support maintaining those 15, whether it's transitional housing beds, whether it's emergency shelter, whether it's housing beds, however you need to describe it? That's the piece that I'm trying to get clarity around from staff in terms of what would be needed for you in order for the subcommittee to ask you to pursue connecting and addressing that funding gap so that we don't lose those 15 beds in the time that we're waiting for the Good Shepherd project to build its additional 65. Thank you.
So through the chair, yes, I think that would be an appropriate direction of the committee. I have to be honest, I was aware that the building was still, continuing to operate, but I was not aware that there was a program that was in financial need. So we're happy to go and have a conversation with our partners and with Native Women's Center about any potential use for those 15 beds and to speak about the funding challenges.
Much appreciated. So I'll move that, and seconded by anybody on the subcommittee. Councillor Farr, thank you very much. And I'll take the chair back. Do we have any other speakers on the list tomorrow? No, okay. So it's in terms of the direction then, clerk, do we need to approve the report before considering the motion? Okay, thank you. So if there's no further discussion on the report, it was moved and seconded. So now we will need to vote to receive the report. All those in favor? Any opposed? Okay. And, oh, Mary Elizabeth? You're voting in favor? Okay, sorry, couldn't tell. There was a lag in the video on my end. My apologies.
Sorry, my internet just.
No worries. And then the motion moved by myself, seconded by Councillor Farr. Those in favor, please indicate with raising your hand. Any opposed? Carried. Thank you all. So thank you, Councillor Collins, we've noted your vote in the chat as well. In terms of other business, moving on with the agenda, I do want to circle back to Councillor Wilson and other subcommittee members who had indicated a desire to, I don't know if we could say gathering of information related to lived experiences or therein. I turn the chair to you. Not turn the chair to you, I turn to you for clarity around the direction that you're seeking. And also Clerk Bates might be able to help us out as well. One of you. Go ahead, Councillor Wilson. Bring your microphone down, please. We can't hear you.
Sorry. I just want to make sure that I accurately reflect the discussion that we had. And here's what I thought I heard. We don't need, nor do we want to direct staff, to request staff rather, to engage in further research with respect to the housing needs that are specific to LGBTQ plus. We know that that research has been done, and there's been some done locally, including by McMaster University. We know that those needs are particular and they are acute, and we know that they are underreported. And it's if we hang our hat on seeking to try to quantify, we're just going to continue the bunny hole iterative of we can't, but it's real. So in that vein, what I thought I heard was we would request that staff come back with a report summarizing that need just for the benefit of this advisory committee and anything particular to Hamilton, because there is that McMaster support report, I beg your pardon, and that summary of need staff could take and use it to inform some recommendations for the consideration of this committee on how to move forward, both in terms of policy and priorities. And I want to make sure I've captured the discussion. So I look to my fellow committee members to inform, refute, clarify, or amend. Thank you.
Thank you, Councillor Wilson. Any comments from subcommittee members? Otherwise, that sounded clear to me. Clerk Bates. That's good. Okay, so moved by Councillor Wilson, seconded by Suad. Thank you very much. And those in favor, please indicate with a raising of your hand. Thank you. Got your vote as well, Councillor Collins. Any opposed? That carries. Thank you. Guess before we move on in the agenda, are there any other items of business that subcommittee members would like to raise? Medora?
Thank you. I'd like to raise the piece, go back to the piece on the mitigation strategy about the benefit, the COB benefit, which is the housing allowance that's being reissued. I understand from Nadia's report by the federal government. I'd make two suggestions in that mitigation strategy. Well, one, that we look at increasing the number, the percentage to a higher number. I believe I heard 33% or so was going to the Indigenous community. I wondered if that was an appropriate number, or if staff could suggest a number that would be appropriate to recommend that be directed to women specifically, and if this committee would support that. And then the other piece is that we can, if the committee or through council can advocate for to the provincial and federal governments to increase the COB and to get more COB and I'm calling it COB, sorry. I know they don't like it when I say COB. So apologies for the housing benefit. So to increase the housing benefit or to maintain the housing benefit. I know staff have been talking to their colleagues in other levels of government about the importance and the value that adds. We've raised it at the Women's Housing Planning Collaborative as well. But to engage the City Council in terms of some advocacy towards that would be helpful or support.
Thank you, Medora. So I heard a question there to staff in terms of clarifying the housing allowance increasing of percentage. If staff had any recommended percentage on that one, Nadia, please. Thank you.
I just through you, Madam Chair, Medora, to your question, the 30%, it's 30% of COHB, and that number has been discussed with the Indigenous community. It's at the upper end of what again, obviously, Indigenous homelessness is largely underreported. So our best estimation is through the homelessness enumeration, which I believe, forgive me, I was on mat leave at the time, but I think it was 22 or 28%. And within HIFIS, the data comes in close to that as well. So trying to boost that, recognizing that 30% will be allocations administered through our Indigenous funding partners based on their own prioritization. Indigenous programs based on their own prioritization, but that certainly Indigenous community members could receive the COHB through other programs, including Housing Up through Mission Services, Good Shepherd, ICM, et cetera. So that number we expect would be a minimum 30%. And likewise, we're very keen and careful to make sure that there's a minimum of 25% of benefits that reach women, no matter what the benefits are as they come to us. So housing allowances, COHB, program spaces in supportive housing units, et cetera. But our recent examples with housing allowances is that when we set a target for 25%, I would have to double check, but it was greater than 60% that actually went to women when we consider families and youth and Indigenous service providers as well. So it's just to make sure that the number doesn't dip below 25, but our experience is that it's typically more than double because the prioritization of women is something that we're sort of stressing across the board.
Thank you for that, Nadia. Medora?
And so one of the challenges that the Women's Housing Planning Collaborative members found with the COB that had been raised was a length of time to get that, to achieve that, to get those out. Now, to women, it takes a lot of time in terms of practice. And so is there any, are they going to be equally given out? Because what the feeling was is that we had to compete with them within the men's system. And we don't want to be doing that. We want to have some assurance that we're going to have. So that's where I'm suggesting the assurance be at least, higher than the 25%. I realize when we combine it with families and with youth, our number goes higher. But when we're talking about the crisis of women's homelessness, it's specifically single homeless women that we've been trying to address where the pressures are, and there's no dedicated number to that. And so it's more nuanced. And again, if this conversation with staff, needs to happen at the WIPIC table in order to have a better conversation about it, that would be fine. I would just highlight here that we need to have some dialogue about how the distribution occurs.
That's appreciated, Medora. I think if WIPIC and staff could work through this issue with a little bit more detail at the next WIPIC meeting, and then the subcommittee could explore what further mitigation options might need to be amended, or how we may be able to strengthen the outcomes that we're aiming to achieve through the mitigation options that were here. Medora, the second component of what you raised was the advocacy to the province and the feds to increase, if not maintain, the housing benefit. And so are you seeking to move a motion through the subcommittee for then council's consideration to approve? Or is there, I guess I'll let you answer the question.
I'd like to, my suggestion would be through your chair to confirm with staff that would be valuable and how they would recommend proceeding.
Thank you to either Robert or Nadia.
Through you, Madam Chair, I have some familiarity with in the past where through the mayor's office on behalf of council, a letter has been written at times where resources are, where the mayor sees fit to, or council sees fit to request additional resources from other orders of government. And I think that should the mayor's office or council be interested in pursuing that option, it certainly would mirror and match discussions taking place at staff levels and could strengthen our advocacy in that area.
Thank you. So it would be appropriate from a subcommittee level for this subcommittee to request council to consider advocating to the federal government and provincial government to increase housing the housing benefit program. Okay, so if that captures it, Medora, that would be feasible for you to move now. If you can have a seconder from the subcommittee. Seconded by Paula. And all those in favor, please indicate by raising your hand. Any opposed? And that carries as well. Thank you very much. So there's no further items on the agenda for today. I thank you all for your participation in this wonderful discussion. May I please have a mover and seconder to adjourn? Moved by Councillor Farr, seconded by Councillor Collins. All those in favor of adjourning? Any opposed? Wonderful. Thank you all for your time and attention this afternoon. We'll see you next time.